Before we jump into this episode, I want to remind you that while Caitlin and Sophia are dietitians, we're not your dietitians. This means the information shared in the Food Freedom Fertility podcast is intended to entertain, educate, and inform. It is not a substitute for medical care. This information is not intended to diagnose, manage, or treat disease. Always consult with your doctor before making any changes. Welcome back to Connection Corner, where you send us your review, your comment, your email, and we read it back to you. We want to connect with you, listener, and every time you communicate with us, we really do read it. And today, we're reading it back for you to hear on air. So today's message comes from Nicole in the form of a glowing 5-star review. So Caitlin, why don't you read to us what Nicole had to say to us?
Must listen. That's the subject line with 3 exclamation points. I never write reviews, but this podcast is so amazing. It's warranted. Not only is it informative, but it's like chatting about life with friends. I've been listening for a couple of years and now I'm 3 months pregnant. 3 more exclamation points. Thank you both for your support, tutelage, and bravery to stand up for what you believe in. I love this review, Sophia, because this is exactly why we're doing this, right? Is
yes,
so that you feel supported, so that you feel like what you
Nicole,
have. Nicole,
you are very kind, and congratulations. We are so happy for you, and congratulations not only on your pregnancy, but on an appropriate use of the word tutelage.
Okay, wait, but what I also love, this is what I meant to say, is when we decided to start this podcast, Soph, didn't we say we want it to just feel like you're hanging out with 2 friends? Like you poured a cup of tea or coffee and you're just sitting around.
No, we do not want this to feel like we're reading from a textbook. You can go on Google Scholar and look up anything you damn well please. We want this to feel fun. We want this to feel social in a way. Exactly what Nicole just described in her review is what we want you to feel. Like you are chatting about life with friends.
We love
it. So thanks, you, Nicole.
Welcome to another episode of Food, Freedom, and Fertility. We are here today, your registered dietitian besties, hanging out in the functional medicine world, helping you get pregnant. And we have a special guest that we're going to introduce to you today. And we're just so happy to be here with you.
So welcome to another episode. So our guest today is Allison Tartari. She is a midwife. She works at a wonderful birth center here in San Diego called Tourmaline Birth Collective. And do you remember the episode we had on with Dr. Jordy and we talked about Allison a lot? Guys, this is the Allison. So she also works as a part of the Thrive Collective, which is the nonprofit that helps you have your babies, get the care you need, and we are pumped to have her on. Thank you for coming on, Allison.
No, thank you for having me. It took a long time to make this happen, so I'm excited.
It did, but we're happy. We're just glad that it's finally happening. So a little bit about Allison. So she is a wonderful midwife, but she doesn't so much work in the birth room anymore. I mean, when I did go there, you were setting up a birth room, but she's not so much going to be the lady that's attending the birth. She does a lot of the behind the scenes, managing the birth center, making sure the midwives who are attending births have what they need, making sure that you, the mother, has everything that you need in the birth center, and helping. I mean, really so much education, so much reaching out into the community, a lot of changing the conversation around birth, physiological birth, natural birth, a lot of helping people understand their options, being able to access what's out there for them, and really making sure that you have your most empowered choices when it comes to how you birth, where you birth, and what's going on in your prenatal and postnatal care. Is that pretty accurate, Allison? You feel like that?
Yeah.
All right. Good. Well, we are having her on today to talk about a topic that's not that fun. It's sort of sad, but it needs to be said because a lot of you experience this, and we want to break the stigma, we want to break the silence, and we want to talk about pregnancy loss. So Allison's here to kind of guide us through some of your options when it comes to pregnancy loss, and different care models during the loss, after the loss, throughout the healing process that you may not know about, that you may not have been offered at your doctor's office, and how to access them.
Well, thank you for the introduction. I wanted to talk a little bit about why we're having this conversation. So it's the way at Tourmaline, being midwives, we obviously see miscarriage. It's rather normal. It's, 1 in 3 to 4 women will experience a loss. So we have all been there when we have a ultrasound clinic the third Wednesday of every month as well. So we're there. A lot of people are coming in to confirm pregnancy.
Mm-hmm.
So a lot of the times we will actually be there when someone discovers they've experienced a loss. And myself, as a woman that has experienced a miscarriage, I know how it was handled when I was told there wasn't a heartbeat, and I just found out at a routine ultrasound.
Mm-hmm.
And my doctor was lovely, very kind, but the way they're trained is that's normal. It's common. It's okay because you're young. You can get pregnant again. You have a baby already. All the normal things that women hear that that most people don't understand that they're going to hear. So when we go to the ER, that's usually how it's approached. And then, so it feels there's a huge disconnect. It doesn't feel very personal. It doesn't feel individualized. So when I became a midwife, it was something that was a really dear friend now that was a client then came in and had been trying to get pregnant for a long time, and she experienced a loss, and it was very traumatic for her. And the way we got to support her, the way my business partner got to support her and myself was just so beautiful, because she was in the center, and we took her back and she received a belly massage. We made a special tea for her that's very nourishing. We were just a listening ear, a shoulder to cry on. That was the initial, right? That's how she was received.
When it's very acute, when you're sort of in shock that this is even happening.
Like just being there to listen instead of medicalizing it and just being like, well, it's, try again, just being there. Sometimes you don't say anything. And the follow-up care is really important. So a lot of the times that will be how it's, if it's someone that's already in care with us, that's how it'll be handled. It's like we send them home with herbs or a tincture, something, depending on what's going on. We have herbs that can support them emotionally, physically. So a lot of times we'll send them home with that, but having them come back or either doing a virtual visit just to talk to them about what is normal, what to expect. It can be hard to talk about it immediately when it's going on. So we might wait a few hours, let them know the warning signs, if they have extreme bleeding, etc., to reach out, but really encouraging them to go home, to acknowledge what's going on. We don't force people, but we always try to tell them, like, please share this with your community. People need to know that you're going through this. It's not in our culture to do that. Most people don't want to share that they're pregnant till after the 12-week mark, because the statistics go down as far as probability of loss. And so a lot of the times people don't know you're pregnant. So when you experience a loss, they don't know you've gone through it. So a lot of people are just alone and grieving at home, and they're afraid to tell anyone and embarrassed, or, there's shame around it.
Yeah, because you feel like you did something wrong. And a lot of times, if you aren't, finding out about a pregnancy loss can happen a lot of different ways. It can be exactly what you just described, when you're in a clinic and you're going in there and you're expecting to see a heartbeat, you're expecting to see little hands and feet, you're expecting to see, life. Yeah. And instead there isn't. Like that is one way. Another way is you can start cramping and bleeding at home, and you can start thinking things are going sideways. And I find that second way as well, women tend to really blame themselves, because often it's the pregnancy was already lost. The baby, wasn't doing well, couldn't go on, completed its life within you. but it was when you were taking the stairs instead of the elevator when you started bleeding. It was when you moved the couch across the room or flew across the country to visit your grandmother or did that workout or whatever that you start seeing the manifestation of the fact that your baby has passed away. And it can be like, I shouldn't have eaten that spicy salsa because the day after I ate it when I was using the bathroom, like that's when I saw, the blood. Or it can make you feel like you did something that made this baby pass away. And you feel a lot of guilt because of that. Like, oh, I shouldn't have moved that couch. I shouldn't have taken the stairs or whatever it was that you did, when really this baby completed its life within you. And it wasn't anything you could have done. It just, you saw that that was happening after you did something physical or used the bathroom.
Yeah. We have a lot of people ask that, like, could this have affected my pregnancy? Something that ate, or I didn't know I was pregnant and I was drinking alcohol. Like, explaining to women, educating them that the majority of miscarriages are simply because it wouldn't have been a viable pregnancy, is really important. And there was another woman that we were working with that she explained it so beautifully when she went through a miscarriage. She's like, I really wanted, she was grieving and she had a hard time, but she wanted to go home and just honor her body and thank it for the job it was doing. And understanding that your body knows what will work and what will not. I thought it was a beautiful way for her to put that, even though she was grieving. She's like, my body knew that wasn't going to work. The baby, it was nothing I did. And she talked about it. She works in the birth world as well, but she said she emailed her clients and she told them that she was experiencing a loss and that she was going to cancel appointments. I thought that was amazing. Simply talking about it out loud. Like, if you broke your arm, you wouldn't hide it. You'd be like, oh, I fell and broke my arm. I can't do, acupuncture today or whatever, whatever service you provide. We're really open about it. But when it comes to pregnancy loss or anything related to women's health, actually, we just don't talk about it. So that's another thing that in these visits, we really encourage people is like to open up about it. And it helps normalize this for other people as well. They know how to support you if you're letting them know what's actually going on. So that was another beautiful thing. And we do have a lot of people in the community that reach out that are not in care with us. So we always want to invite people, if you visit it's thrivewellnesscollective.org, our website, there's more information about the miscarriage support program, but you can call Tourmaline, and we're adding to the list of midwives and healthcare practitioners that are willing to help with this program. But you can call Tourmaline at this point and just let them know that you want to schedule a free miscarriage support visit. And it's going to be one-on-one with a midwife. It usually lasts around an hour. It can be in person or virtual, whatever the person is feeling. And it's a non-emergent visit. So we want to make sure if they're worried, if people are hemorrhaging.
Nothing is. Because losing a pregnancy can be a natural process. It doesn't always mean it's an emergency. You don't necessarily need to go to the hospital and have all these things go on. And we can talk about that a little bit later, like what maybe would mean you needed to do that. But yeah, just go on.
Oh, okay. Well, because and in our social media, we try to educate about this as well. Like, we've shared many things that you have posted personally, and we're always looking to empower women the same way we're trying to normalize birth. Miscarriage is a birth, and it's a pregnancy. There's a loss. It's a birth. Like, this is normal, and we need to normalize it. It needs to be talked about. So we want people to know it's not always an emergency. That your first the first person you see, you don't have to run to the ER. You can reach out to midwives in the community. You can reach out to your OB to ask questions. But normally they'll tell you to go to the ER, and a D&C is usually offered to kind of speed the process along. And for some people, that's the right choice, but it doesn't have to be your choice. So just letting people know all of these things, like what to look for. There's an article that I really enjoy that Dr. Aviva Ram wrote.
No, we love her.
If you've ever seen it. Yes.
I don't know that I've seen that particular article, though.
So it's how to have a safe miscarriage at home. So that's on our website. And I love that she kind of put everything together and explains what a D&C is, because there are side effects to that as well.
And
a woman needs to know risks. Yeah, they need to know what it means when they're doing that and how they can nurture their body and take care when they get home. The biggest thing is whether you have children or you're working, you know, everyone has their life going on. Because miscarriages and losses are not normalized in our community, most people will go home and pretty much continue on with life, and they don't give themselves enough time to just sit with it emotionally and grieve, but also physically. We want them as midwives, we're like, please go home, call your work, let them know what's going on. Let your friends, your family, your tribe, you know, your community know what's going on. And we offer to set up a meal train for them to provide food, because the family are more than likely going to be grieving as well. And it's an important part that often gets left out. So we talk about the simple things that you can do to make sure that you are honoring this process and nurturing the woman's body. There's so much. You let me know if I'm going off. There's
this
just so
is
many
so
aspects.
wonderful. No, keep going about this, because this is exactly what people need to hear in specifics too. This is all what people need to hear. Yeah. And just because something is, listener, I just want you to know, just because something is normal doesn't mean that it's fun or easy or comfortable. It doesn't mean that it's not going to come without an intense emotional load, that it's not going to be physically demanding. It's normal that this is something that happens as a part of the human experience, as a part of life. To be open to life is to be open to death. And there isn't a way around that. I wish there was, but there isn't. And that's just the way that this goes sometimes, but doesn't mean, we're using this word normal a lot, but doesn't mean that it's going to be a trip to Baskin Robbins. It's going to be
That's true.
Emotional.
Yeah, thank you for
and even
bringing
can
that
be
up.
physically painful.
Yeah, so we talk about that, like the physical aspects, what it can feel like, what it can look like. And even though, as you mentioned, miscarriage is normal, and we're talking about normalizing it, it's not normal. Many of the side effects and things that happen with women when they're going through this, because I'm going to use the word neglect. It's a lack of education.
I think that's a very accurate word.
It's a lack of support. It's a lack of individualized care. So having a woman just go home, whether it's just to let the miscarriage happen on its own or with pills or whatever whatever plan they choose, without follow-up support, without checking in with them within 24 hours, it just doesn't make any sense. And we have a really high rate of rehospitalization because of this. A lot of women, we've been meeting with different ERs. There's another nonprofit in San Diego that helps support pregnancy loss. They go about it by educating hospitals and ERs on how to accept a woman, terminology to use. We want to educate people in the ER. The terminology is very important, but also, what is the follow-up care? Like, what can we do to make sure these women aren't being readmitted for infection, for excessive bleeding, for emotional, for postpartum mood disorders, which do come along. They can be just as prevalent in pregnancy loss. You don't have to have a baby to suffer from postpartum mood disorders. And it's really important to acknowledge that.
Because you are postpartum after you have a pregnancy loss, right? Your body will go through what a postpartum mother goes through. Sometimes a lesser degree, depending on where you were in your pregnancy, sometimes a greater degree, because you aren't also caring for your baby and staring into the eyes of this new life that you wanted so much.
Right. And it's the importance of the postpartum period with the midwives and the visit that we offer. We talk about like those nourishing foods, how to rebuild your body, how important it is to strengthen your blood, all of these things. The same way we talk to moms that have given birth, it's the exact same thing with the different emotional aspect to it, right? Different emotional support. And the grieving aspect of it. But grief can really affect us physically. It can make us very ill. And people don't realize that. So if you're trying to go back to work and just act as if nothing happened, or, continue on your day-to-day life, it's going to come up. It's going to affect you at one point or another. Like, you can only avoid things for so long.
You're going to have to pay the man at some point.
Yeah.
Yeah. Well, so let's take a break and hear from our first sponsor. And when we come back, we would love to hear about these nourishing foods and nourishing herbs and some of these things that you guys use to support mothers as they go through pregnancy loss. So we'll be right back. We're taking a break to talk about our sponsor, Fertility Cloud. In working with hundreds of you ladies, we have noticed a problem that has come up. I know it's come up for me, Caitlin. It's come up for your clients as well. And that is not only finding a doctor who is going to know how to help you, but one that wants to. We have a lot of issues here, and sometimes getting a simple blood test or actually getting a medication or talking to someone who's actually an expert in fertility can not only take an insane amount of time, but it can feel like you're fighting your doctor.
Yeah, or you're playing like Russian roulette to get in front of somebody who actually cares. We are so excited to be partnering with Fertility Cloud because they have a solution for all of these frustrations. Just last week, I had a client that needed right now care, and we couldn't get her in front of an OB. And she got a same-day appointment with Fertility Cloud and spoke to a reproductive endocrinologist and had a prescription that she needed in her hand hours later. This is a solution that our industry desperately needs, and we are so excited to present to you.
So if you're in a remote area and you have to drive 4 hours to go see a doctor, or if you've been to multiple doctors and none of them seem to really listen or really care or want to take an approach that works for you, start up with My Fertility Cloud.
My Fertility Cloud has provided us a link, so check it out in the show notes. That will get you $25 off your first visit with one of their providers.
We're taking a quick break from this episode to talk about one of our sponsors, the Prenatal Nutrition Library.
We love the Prenatal Nutrition Library. It's a searchable database and app, which means you have answers within seconds and peace of mind that what you're eating during pregnancy is both safe and nutritious.
It's almost like having your own personal pregnancy dietitian in your back pocket that's going to not only tell you, is it safe to eat this? How much of that should I have? Yada, yada, yada. But give you actual meal plans so you know how to put it all together onto your plate today. And the meal plans are trimester specific, meaning, some women are kind of nauseous in their first trimester and maybe they need specific foods to help combat that. Prenatal Nutrition Library has got you covered. Or the fact that your baby's brain is growing rapidly in your third trimester and you need your nutrition to support that. Prenatal Nutrition Library meal plans has got you covered there too.
This is evidence-based information. Registered dietitians are in this app weekly answering members' questions. There's an exclusive podcast within the app that's run by Ryan, who is the prenatal dietitian that founded this entire thing. It's a wealth of knowledge and resources and will take you far beyond that one-page handout your doctor handed you that actually probably has out-of-date information about eating in pregnancy.
So head on over to the Prenatal Nutrition Library as soon as you get your big fat positive. Well, okay, first message me and Caitlin so we can do a happy dance with you. Then head over to the Prenatal Nutrition Library to get clear strategies to meet your nutrient needs, as well as to take the stress out of confirming what's safe and most optimal for you and your baby while you're pregnant. Use code FFF20 for 20% off. Okay, we are back. And Allison, we were hoping you would share with us, like you mentioned nourishing foods, nourishing things, some of the just stuff that you can do to make the pregnancy loss process maybe a bit more comfortable, and to kind of help step into the grief space and not just strap on a pad, pop some ibuprofen, and go do that presentation for your boss.
Yeah. I think this is a great segue into talking about, you mentioned the box that we have created.
Yeah. Tell us what that is.
And I want to finish the story really quick because I talked about the women before.
Don't let
that
us stop
came
you.
in.
We want to hear it all.
Well, it's tied. So the woman that came in before, that was trying to get pregnant for a long time, and she suffered a loss with us, and it was a beautiful way we got to support her, like taking her in the room and doing the massage and making her the tea. Well, she came back after that and wanted to start a box that would support women that were going through what she did. And it was really beautiful. So out of her experience, she's also a holistic nutritionist and has a lot of information about fertility, and a lot of her clients are going through infertility issues. So we started a subscription box, and it's called Box for Loss. So it's just boxforloss.com. And in there, a lot of the things are the products that we would use as midwives to help support our clients. So there's something called lifting tea in there, and that's going to help to support women during this time of grief emotionally. And it has like motherwort, mugwort, elderberry, lemon balm, marshmallow root, skullcap, and chamomile. So that is the tea that's in the box for a more emotional support. And then another one that we use all the time that we give to all of our clients, and when they've suffered a loss or if they're anemic, we have a mineral-rich tea that helps. It's very fortifying. It helps to build the blood, which normally there's a blood loss during miscarriage. And that one has organic red raspberry, rose, marshmallow, dandelion, nettle, alfalfa, chamomile, oat straw, and peppermint. So those two are really beautiful. In the box as well, it has, which we've gotten really amazing feedback from, is the period underwear. Being able to put those on and have, a way, sometimes depending on the level of bleeding, because everyone's bleeding is different, you might need to add like a pad. There's also a pad in the box to layer, but having the period underwear, and it also comes with a pad that you can put on your abdomen. It's a hot or cold pack. Most of the time you're going to use heat. We always recommend heat.
So heat.
Whenever you're healing. So you're going to heat that up, and you can put it in the underwear, and it'll be against your abdomen to help with the cramping and the discomfort that you do experience with the loss. And it's important that women know most people do experience that type of discomfort. Not everyone, but most people do. Another thing that we use that we remind people of is to keeping our electrolytes, the pH of our body, balanced when you're going through a loss. So in the box, there's a little elixir that is a natural electrolyte. We also have a recipe that you can make at home, which is really easy, but staying hydrated, eating nourishing, warming foods. We love bone broth. It's very healing.
Yeah, that's a good
Using it as a base for anything.
Soups,
if you want
rice, grains.
Soups, anything. Yeah. So putting bone broth in there. And we suggest Chinese medicine is huge on, and Ayurvedic medicine on warming foods during a period where you're healing emotionally or physically. So we talk to people about that. We either, if you want a smoothie, it's fine. There's nutrients in it, but the warming foods are what we try to steer people towards during this time. Also, I'm looking at the ingredients of the box. We have a
She's
beautiful...
being so thorough, listener. We've told her so many times, like, we don't need it to be this way. But welcome to Allison. She just wants to make sure she's doing a good job for you.
So there's a lot of physical things in there, so I won't go over everything. But something that's really beautiful about this, and that came from the way we saw we could support partners, is in the Box for Loss, there's a letter to the partner. And it's sealed. And it says, please hand to your support person. And it goes into detail, acknowledging that they're grieving. It goes into how they can support the person that they love that's going through this loss, what to say, what not to say, things that they can do to make this time easier for them. And we're in the middle of, on the website, trying to create a support person's support group, because we have these visits for the person that's experiencing the loss, but we really want to make sure that the partner has someone to talk to as well. So I think that's beautiful. They often feel
like they just need to be strong. They need to not feel. They need to be strong. They need to be the shoulder for you to cry on. They need to dote on you and take care of you because you're the one that's physically experiencing the loss. And a lot of times they don't even want to face their own grief. They don't want to go through all of that. So they just sort of eat the pain and keep moving.
Yeah.
But like
There's
you
a
said, you got to
study-
pay the man sometime. It's going to come out
Yeah.
some way.
There's a study showing that partners experience it's about 2 years after. If it's not acknowledged and taken care of at the time, there's a study showing that the average is 2 years for the partner to experience that grief. So that's a long time to sit with something. And most people, or not most, but a lot of people maybe will have already had another child and still not dealt with that grief or acknowledge that. So that's part of the box. It's part of the miscarriage visit. We always tell our clients, if they want to bring their partner, they can, or they can bring them in at the end of the visit. We just want to acknowledge the importance of everyone in the family feeling safe to talk about this loss.
Yeah, because that was your baby too. That was his baby too.
It was a dream. You already had plans, and the minute someone finds out, they're planning for the future, college. I mean, it's
everything.
The connection,
everything. It changes because and I want you to understand, listener, that a pregnancy isn't just a uterus with a baby in it. Your entire body changes. Your metabolism, your hormonal levels, the cellular structure of so many things, your brain, all of these things change and start shifting from I am an individual here to baby on board. There's another person here that needs all the nutrients and everything about your body changes. And when you birth your baby, whether it's through pregnancy loss or after full term, your body goes through a huge change again. And it's not just an idea. I think that's something that people get like stuck with, is they think the baby was just an idea. It was just a dream. And it's not really that way, because a dream is like, oh, we thought we were going to buy this house and then somebody outbid us. Or I really wanted to get into this college and I didn't. Or I thought I was going to get this promotion and I didn't. And all those things can bring a lot of grief. But it's not just a dream. Like, your body changes biologically when a pregnancy begins. And it's going to be more than just the loss of a dream. It's not something you're making up. You really are physically experiencing this in every way.
Yeah. But I don't think people know that because they're not told that.
They're not told that.
It's not acknowledged. The physiological changes that happen.
We are changing that today. We are changing that right now. Yeah. And I what are some, I mean, maybe let's just go into that. Like, as the midwife, here's a question that I think a lot of people have. Just put on your midwife hat here, Allison. Why is it that when you have a pregnancy loss, why does this baby, the tissue, everything, why does this have to come out? Why doesn't your body just like absorb it and keep going? Why do you have to birth this baby?
That's a really interesting question. Well, from a midwife standpoint, the same way the body, because the tissue that is there and the things that are changing, they were not there before the pregnancy, right? So once the egg is fertilized and it starts growing, it's its own little like universe in a way. And so if it's not going to continue to grow and it's not going to be utilized, then it's then seen kind of, I don't know how to word this in a nice way, but as a foreign, like, oh, it's not meant to be here anymore.
Not self. It's an individual. It's not you. It's something. It's its
own
baby.
thing. Yeah. And it's everything involved, and how quickly the changes happen from day to day is amazing. Like, to watch it. A lot of people aren't aware of that, as well as the cell starts to divide and all the things start happening. It's creating its own little universe in your womb. So once the baby can't grow anymore, it knows that world is no longer needed. And medically, it needs to come out because it can lead to infection, retained tissue. It can lead to hemorrhage.
You also need
so I'm
to
not
birth
exactly sure what
the
you were
placenta,
looking for.
depending on how big, like that piece of it needs to come off too, even though that's not baby.
Everything in there was created only to sustain that life and that whole other world. So if that life is not going to continue, then everything has to come out to make room for that process to happen again.
Wow.
I know
Thank
that.
you for sharing that. I think it's something people wonder, why is it that my body can't just absorb whatever this was
Yeah.
and, keep going? But biologically,
Because
physiologically, we can't.
no, it's another, I mean, the placenta is the most amazing organ ever. Like, we could talk about that forever, but that is, like I said, it's just those things are just created for that one experience
Purpose.
in that world.
Yeah,
Yeah.
it's a unique being. And I think that speaks volumes as to why there's so much grief, because similar to you, Allison, when you lost that pregnancy, you already had a baby, you went on to have other babies too. But it wasn't that baby that you lost. And I think that we need to understand that, because a lot of times in the trying to conceive world, people think as soon as as soon as I do get pregnant again, I just want to get pregnant again and have my baby to keep. And that is a wonderful goal and great, and that will bring joy and wonderful things in your life. But it's not going to be that baby. It's not going to heal that loss. It's not going to pave over what you just experienced and make it all better.
No.
It's because it's a different person. This baby won't be that baby, and your body knows it, and you're going to have to kind of acknowledge that and move through that at some point as well.
And that
Yeah.
grief and healing process is also essential for future pregnancies, because
It is.
I think that what you just brought up, Sophia, is really common in a first loss. But for the woman that has had multiple miscarriages and very often in a row, now pregnancy alone is its own. Every day is anxiety inducing, because when is the day the shoe's going to drop, right? And so acknowledging that and working through a grieving process and working through the trauma that's associated with it is really important for not just your mental health, but your physical health going into another pregnancy, if that's the course you choose to take.
Yeah, Caitlin, that is a wonderful point, because one of the questions that we ask, which not all doctors do, OBs that is something that many organizations are trying to change and make sure that it's addressed. But have you ever suffered any loss, whether it's an abortion, ectopic, miscarriage? We want to make sure that we find out if they have suffered a loss in the past. A lot of people after several years feel like, oh, I don't need to address that. But when they get pregnant again, almost always that comes to the surface, and it can affect their pregnancy. It can definitely affect labor and delivery. And so in our model at Tourmaline, all of our clients meet with our holistic psychotherapist, but if they've had a loss, they get free. There's, along with the miscarriage, the pregnancy loss support group, they get free visits with our therapist to go over that. Maybe there's not a lot to unpack, but most people, once you're acknowledging and sharing with them the impact it can have on their pregnancy, and even the partner that hasn't acknowledged it, how they might not be able to support in the right way, or they might start grieving and not understanding why. It's just really important to talk about that. It would be great before you're pregnant, but when someone is pregnant, like asking, have you ever suffered a loss before? How can we support you? Did you receive any support, therapy? What did you do to help yourself move through that and go through that journey? Because we've seen many times there's a lot of fear, guilt. The guilt will come up again. Women that are happy, excited about this pregnancy, and they'll start reflecting on the loss and feeling guilty. So it was interesting how you said, Sophia, that even though they get pregnant, it's not that baby. A lot of people don't understand that until they get pregnant again.
Yeah, they think that this is going to be the magic cure, that having another baby, getting pregnant again, is the silver bullet to solve it. And rightly so. I would want that too. I would want anything to get you out. When you're grieving, when you've experienced a loss, you want a cure. You want to just move past it. And you're not wrong for wanting that. It just doesn't exist.
Right.
It's not there.
We have the butterfly wall at the center, and it's beautiful and sad at the same time. So we have pictures of all the babies that have been delivered at the center, or that were born at the center, on one wall, and across is our remembrance wall. And it's all the butterflies of women that have suffered a loss. A lot of the time, I have to say it's months and sometimes even years later that they're coming in to put a butterfly up. A lot of the time it's not right when they're going through it. And it's beautiful that they have a way to go in and acknowledge some of them, like with the one woman, the founder of Box for Loss. She came in once she already had her second child. Her and her husband came in and put one up, and she filmed that, and it's public, so I'm not sharing anything that I shouldn't be. But we want to give that, it's another little way to acknowledge that you went through something and to honor. Sometimes they'll write the name of the baby or the date, their due date, their estimated due date, whatever serves them. We just want to try to give as many ways as possible for people to commemorate this experience. And in the Box for Loss, we have some journal prompts as well that we really want. Writing down things is very healing. And we also have some seeds for them to plant, like to create life and memory of what some people will take the tissue and bury it, and they can put the flowers on it. Some choose not to.
Let's take a break, and then we'll talk about, because I have a question about that, about what to do with your baby's body and all those kinds of things. So we'll take a break, and then we'll come right back and talk about that.
Hey guys, we're taking a break from our episode, and I want to talk about something that's super confusing. When you head down the supplement aisle and you're looking for a prenatal, and on the prenatal bottle itself, it says, do not take if you're trying to conceive, pregnant, or breastfeeding. Like, what the heck?
Yeah, it says, talk to your doctor if you are pregnant, could be pregnant, breastfeeding, postpartum, whatever. And every supplement has this. You go down the supplement aisle, you go shopping on whatever supplement website, and there's a disclaimer on every bottle of every single thing, which means that everything that you've been taking your whole life long is now a big question mark about whether or not you are potentially harming yourself by taking something where you're trying to be healthy. So that is why we partnered with Needed. Needed is a perinatal nutrition supplement brand that has a wide array of products specifically designed for women who are pregnant, trying to become pregnant, breastfeeding, or postpartum. So it's not just that these products like can work if you're in that situation, or, oh, it's probably okay if you take it while you're trying to conceive. No. These products are researched, they are formulated, and they are put together specifically for women who are trying to conceive, pregnant, breastfeeding, and postpartum.
This answers so many questions. I always get asked, like, what can I take? It's cold and flu season. What's safe? Needed has an immune support. That's safe whether you're trying to conceive, pregnant. It's even safe for your little ones.
And it's not just immune support. They've got collagen, they've got hydration support, they have digestive support, they have prenatal multi. They even made a line for dudes.
Needed is somebody we're really proud to be partnering with. So head over to their website and use code FFF20 for 20% off your order.
Okay, so we are back. Allison was just mentioning that there are seeds that you, like flower seeds, garden seeds that you can plant that come in the Box for Loss. And it got me wondering, I would love to hear about kind of at what stage gestation you'll see various things as a part of your pregnancy loss. You know, when would somebody see what looks like a baby? Because at some point in pregnancy loss, I know it's just sort of seems like a heavy period.
A clot, almost.
Yeah, a clot, maybe like a little bundle of tissue. But I've had many clients and known many people that were absolutely shocked when they saw a baby, what looked like a small human baby, and what was a small human baby.
With me, and so with my personal experience with my miscarriage, when the doctor, I was supposedly like 13 weeks, but when we went in and looked, the baby had stopped developing much earlier. So I passed a sac. It looked very clearly like a sac, very heavy, bleeding, and a sac. If it was 12, 13 weeks, if you look at the There's a lot of videos out there that shows you what a baby looks like.
Yeah, like illustrations of
yeah.
how
So
a
after
baby grows.
12, 13, 14 weeks, like there's huge changes every week, and it depends on if the baby is actually developed to that point, because a lot of miscarriages will go
Yeah, just because you
undiagnosed for
are
a couple
finding
weeks.
exactly, just because you're finding out that you lost this baby at 16 weeks doesn't mean that that's how far along the baby's development went or how far along the pregnancy went. It can often be much earlier that something went wrong and the baby couldn't grow anymore. And so it might not, I see what you're saying.
And 16 weeks, if it was gestationally 16 weeks, it would definitely have
Like,
the appearance of a baby. And we've experienced that before. And it's important that people know, even at that, at 16 weeks, it still can be managed at home. I was asked, this is interesting, I was asked to save the tissue when I was going through my miscarriage, and just seeing the sac, even though it didn't look like a baby, was very emotional because it was clearly different than what I had seen before. And
it wasn't just period blood. It was clearly made for a baby.
Yeah. And we've had women suffer losses later on around 15, 16 weeks, and they were just supported by the midwives. I'm trying to think how to not go into too much detail, but they can choose what they want to do with the baby. Midwives know how to monitor, if there is too much, if the blood loss is too much than we're comfortable with, or, your body knows what to do. It knows how to,
it's birth
to give birth to this child, even though it's not a child
alive
that's going to be living. Yeah. So that is a choice that people can look, that's why Thrive, the nonprofit, that's why we started it, because most people, only 2% of people give birth out of hospital. So that's a really small percentage of people that know about midwives, right? So this isn't about giving birth. This is about having the knowledge of what a midwife does. And we're trained in all aspects of birth, whether it's loss or a baby actually being born, postpartum. So it's something that you can look to the community for. You can call Thrive. You can email them to find a referral of, and on Box for Loss website too, there's a lot of referrals for other organizations and other practitioners that can support you during a loss. So you don't always have to go to the hospital. We're not ever saying that you should not. We just want
there
you to know
are circumstances where you would advise somebody to go seek a higher level of care.
Yeah,
we're not giving medical care. It's not always necessary.
Right. There are ways to do it safe at home and in a way that you can honor that that process, and it can be healthier for the mom, and she's surrounded by people that understand what she's going through and can be compassionate and give the empathy.
A lot of people don't have positive experiences at hospitals. Like a lot of times that's not. Caitlin gave a big piece of her family history when she was sharing her birth story, that her sister-in-law passed away and her husband was there when that happened, and it was just an extremely traumatic experience. And so her husband just didn't think he could have a happy time catching his baby in a hospital because of how he feels about hospitals. And that was a part of why they chose an out-of-hospital birth for their children.
And sorry.
Yeah, there's just so many reasons that
there's so many
you
reasons
can want one thing, or maybe this isn't your first loss
sometimes,
and it didn't go great at your DNC. But could we give some more practical, maybe somebody's listening to this or thank God this isn't me. I'm trying to conceive, but I haven't had a loss yet. Because this is so taboo and people don't really talk about it, somebody might not know ahead of time going into the ER what their options are. So can we kind of sift through the basics of what would happen in a pregnancy loss, maybe at different points in the pregnancy, and what might be available to someone with a midwife, with their OB, et cetera?
Yeah. In what way do you... Tell me what exactly you're looking for. Sorry.
So for instance, let's say somebody goes in and has an ultrasound and it's supposed to be the dating ultrasound. They're supposed to be, 6 to 12 weeks pregnant, let's say.
Mm-hmm.
And we see that there's no heartbeat and, gestational, like there's no pull. We've somehow dated and we know that this has been a loss. What is that person's options? The doctor may offer them X, Y, or Z.
Yeah. And so this is really different if someone was in our care than if they're going to the hospital. So if you're in the hospital, they're going to verify, that there's no heartbeat. And then normally from what I've seen with clients that I've supported, they tell you can go home and wait, or they can offer a D&C to get it done, to speed the process alone. And emotionally, a lot of people don't want to wait and they want to get this done faster. And a D&C is the same that they would use, process they use when giving an abortion.
In the work that I do, I work with so many people that have irregular cycles, and ovulation, isn't on day 14, like they say. And so when you go into your dating ultrasound, very often they're asking a question of when was the first day of your last menstrual cycle. And then that question gets answered and dating starts from that first day of your last period, right? And so with these dating ultrasounds, I've had more than 5 clients. I mean, I say more than the fingers on the sand, and I put my hand up because that's 5 babies' lives that could have been terminated because a client went to an ultrasound and the ultrasound tech expected them to be a certain period along in development, and there wasn't a heartbeat, or there wasn't a fetal pull, or there wasn't this, or there wasn't that. And so my client has been told, the baby has stopped developing and this is not a viable pregnancy, and offered medication. I can think of 2 specific times where the person left the clinic with medication and either emailed or called me in tears to recount what was going on. And, we slow down. My relationship with my clients, we're very often tracking symptothermal methods of ovulation. And we can go back and say, well, yeah, that was the first day of your last period, but you didn't ovulate till day 40 of this cycle. So really, baby shouldn't be this far along yet. And, in a case like that where you're not symptomatic, there really isn't harm in waiting and getting a repeat ultrasound 1 week later, 2 weeks later. And in these cases, there are babies' lives that exist, pregnancies that came to a very happy completion because they didn't take that advice. And, this is a piece of the modern medical model where OBs oftentimes have way too many patients on their caseload that they don't stop and look at the PCOS diagnosis or the history of irregular cycles. They're used to PCOS babies coming from a Clomid or a letrozole induced cycle and ovulation being a little bit more predictable. And, if just one baby's life gets saved that way. So part of the question that I'm asking also includes what should people be testing for a week later, 2 weeks later, 6 months later, if there are things that you recommend, because you do treat loss differently and almost, I want to say sacredly, in a way that really honors what's actually happening.
Yeah, and you have to remember, we work with mostly, I'm going to say low risk clients, healthy. It sounds like your population is a little different than who we normally be working with. But in the miscarriage support visit, like I said, we do follow up. This is what we do: is we do the follow up HCG, blood draws. Excuse me, my brain went blank. 2 to 3 to make sure that the HCG levels are going down, that the body is getting ready to pass the baby, that nothing is being retained that could cause injury to mom. So that's kind of where we stop our care. as far as fertility going on, like testing 3-6 months down the road, we'd be referring to someone else. But just for safety reasons, to make sure that this is a normal miscarriage, right? Where things are happening physiologically the way they should. That's why we recommend doing the follow-up HCG and ultrasound, repeated ultrasound if needed. So that's kind of as far as we go with that. But we have had 3 clients that I've talked to that have experienced something similar to what you were describing. One of them was pregnant with twins and did have a miscarriage, but they did not know there was another baby. And so she found out several months later that she was still pregnant.
Wow.
And it was a beautiful thing, but also very
shocking
and traumatizing in a way. It took her a while.
Because it's like, whoa, I should have been doing something to...
And it was an ectopic one. So the first one was an ectopic. It's crazy. So she bled. She had to go through a similar procedure. And
wow,
it was
talk
very
about 1 in a
traumatizing.
Million. That's so rare.
So
it's so rare, but these things happen. And that's like...
Yeah. But that's where individualized care comes into play.
Allison, there it is.
That's why it's
listeners.
So important. Like,
boom, Kanani, because it's not rare when it's you.
Right. Like we just need to be talking to these families, these women, and
it doesn't feel rare
seeing
when
how
it's
we could
happening
support
to you.
them. Yeah. And it doesn't make it any better saying, well, this doesn't happen often.
Yeah, exactly.
That doesn't, it's knowing the statistics.
Well, it's happening now. So what do you want to do about it? Yeah, that is so important. Okay, let's take our final break. And when we come back, I want to talk about options on what to do when you pass your baby, your whatever, when your baby comes out, options of what to do. And then we'll end that with a yeah girl, because this has been so important, but heavy. So here's our last break. Hey, it's me again, Sophia Pavia, registered dietitian nutritionist specializing in women's health, fertility, and optimal progesterone production. And I'm interrupting an episode of my own podcast to tell you about my online course called Ovulation Unlocked. So if you've been listening to our podcast episodes, you've probably heard a lot of things about basal body temperature, cervical mucus, cervical position, and tracking your fertility. Well, I have designed a 90-minute self-paced online course, which I titled Ovulation Unlocked, that puts all of that together and teaches you how to be the expert on your own fertility from home. This course is designed to put you in the driver's seat of your own fertility, not only so you can know what's going on with your body on any given day, but so that if you need medical help, you can show up to the appointment informed and ready to communicate. Too frequently, us women show up to our doctor's appointments and just say something like, I want to have a baby. And the doctor looks at you and says, good for you. Stop using birth control, start taking a prenatal, come back in a year if you're not pregnant. And that's all we get. However, Ovulation Unlocked puts you in the driver's seat, puts you in control of your fertility, to where if you need help, you can show up to that appointment informed and ready to communicate your needs. So if you want to become the expert on your own body and your own fertility, head on over to my Instagram bio and tap the Ovulation Unlocked link today. So we're back, and along the lines of the fact that your body completely transitioned to making a whole nother human being. And even though that human being did not live outside of your womb and completed its life within you, it has to come out at some point. And Allison, can you tell us some of kind of what to expect and some options? And I'm just going to be very candid about this. Is a lot of times women feel these sensations of what can be described as like labor, and it kind of feels like they need to poop. So they go to the toilet and they birth out their baby, or what your body had inside of it to support your baby. And I've spoken to many, many women who just sort of reflexively flushed the toilet, or they didn't really know what to do about it. And they wish they would have known that there were other options. And so can you sort of speak to that, what some of those options are and how to go about that?
Yeah. And I don't know, there may be other options. There may be organizations and people that offer other options, but with our clients, we've seen, and even in the hospital, I've seen some really beautiful offerings sent home with moms, like a little tray to be able to catch the tissue or the baby, and a hand woven little like sock to go over it, to honor it the same way you would put a little hat on your baby when you're bringing home. It's something like that. And so thinking ahead of time, again, I when we're talking about this, I feel like you have to have someone there to help you. I don't think a woman is going to sit there and be able to go through and reason all the steps and prepare for this.
No, this is meant to be community supported, family supported.
So as a midwife, like bringing something to be able to collect the baby, and, depending on how far along they are, again, after 20 weeks, it totally changes legally.
Yeah, your baby's body in whatever stage of development it was in.
Right. So we have people that have decided to preserve the baby for a while until they can plan where they would like to bury the baby. And some of them have used ice. Obviously this is very short term, but planting it under a flower bed or doing a little ceremony, a little service, a private service. We've had many people do that. I don't, everyone feels differently about it. There are people I know that have even gone and had the baby cremated.
Yeah.
Which could be a more expensive option, but it's an option. Like just knowing that you can do that.
Exactly. And your family's culture and the way that you handle the death of loved ones is very private, maybe not private, but very personal. And thinking of your baby as a loved member of your family in this way, and not a piece of your period that you're just going to wipe and flush, because that's kind of what we've done all of our lives as menstruating women. And maybe that is what you want to do. I'm nothing against moms who decide that that's the best way to do things. That's what's readily available and already in your home. There are other options if you want to do something different.
Yeah. And there's another midwife that I followed her loss, and something that's very beautiful if it feels comfortable and it sits with you spiritually. And like you said, whatever your culture is documenting. She had a picture, and this was at home. It was very early, but of the tiny little hand. She took pictures for herself to remember this baby that she was very much in love with. So there's, again, when a woman starts the process of a loss, she might be like, oh, I want to take pictures of this. So again, it's just putting it out there so that maybe someone can support you with that. That's another option. Also, for moms that are further along and experience a loss, there's a company, and I don't know the names, but if you Google it, you could find it. And when you're further along and you're producing breast milk, they'll make a
piece of jewelry
out of the breast milk, as in remembrance of that child. So there's a lot of things that can really make a big impact.
Yeah, I know of someone that does jewelry out of pregnancy tests and takes the plastic or whatever of the test and makes like an ornament or jewel of some kind, because sometimes that's all you had of your baby was those two faint lines, and then that's as long as your baby lived. And I can't think of who it was, but it's out there.
Yeah, if you Google it, you'll find it. Even if they're too early and it's a very early loss and it is bleeding, the reason that we put those seeds in that box for loss is you still can do things to commemorate. So even if you don't have a physical baby to commemorate, or to, trying to figure out what you're going to do with, if it's just the bleeding, heavy bleeding.
Yeah, if your baby wasn't big enough to see.
Yeah, do something to commemorate that. That feels beautiful, that you can visit later or open up a box and
gives you a little closure, some sort of ceremony. Ceremony is so powerful, and to have sort of that closure, that ceremony, that process, whatever that looks like for you.
And sorry, I didn't mean to.
No.
Ceremony is, that's the word that I use when we're doing tours at the birth center. I'm like, our goal is to bring ceremony back to birth.
Oh, beautiful.
Because it is a beautiful ceremony, but it's the only thing. Like, we spend $20,000 to $30,000 on weddings, the average American, and then we spend thousands of dollars on funerals. Birth, we normally choose where our insurance covers, and there's no ceremony, and you're looked at, it's an illness. So, that ties in with loss as well. Like, these are both ceremonies that are really very neglected. And I did a podcast with Rosebud Woman. I don't know if you guys know that company. We have their salve. It's vaginal care. It's amazing, all natural, beautiful. It's in the box. And I was talking to the founder of that company, and she was doing her dissertation on loss around the world. And she was talking about how other countries honor miscarriage. And she showed me a picture in Japan, and it's these beautiful little statues. Each one is a miscarriage, a loss, or a stillborn. And it's just thousands of them. And they honor that because that is their family. That's their life. And that's just one of the examples that she shared for me. But it's with me. It was stuck in my head because it was just so beautiful and so different than what we experience here, where we're not even supposed to talk about it because it might be uncomfortable for someone.
Yeah, or someone else might feel uncomfortable at the fact that you lost a baby. Yeah,
they won't know what to say. So,
well, our ceremony is the girl.
That is what we do. That is the end of each episode,
and we need it today.
We do a girl, and we need this today because this has been so important and eye-opening. And I know that this is absolutely going to just be medicine to so many women. But let's bring it on back to a positive note to end on, and we'll do our girl. So who's got a girl?
Because you told me to think about it, I've been thinking about it.
Okay, we're ready.
But can I do a big and a little one?
Yeah.
You can do as many as you want. Big and little. 2 girls.
Because
I'll girl you as much as you want.
Okay, because the big one is really exciting to me. And Thrive, we have been talking about this forever, and it's still in the beginning stages, but our plan is to open a intensive outpatient clinic where women can come for maternal mental health, where women can come and get the support they need with their baby. There's someone to care for their baby so they can breastfeed. Every holistic practitioner, their therapist, their nurse practitioner to manage their meds. A beautiful space for women that need support postpartum to help alleviate the need to go to the ER. So that has been taking fruition. We met with some amazing people that are helping us actually build that business model. So I just wanted to share that because we've been talking about it a long time.
That's awesome. Gosh.
But it's actually in the works now.
What a wonderful, wonderful heart you have towards women who are growing their families.
It's just so needed here.
Oh, heck yeah.
Maternal mental health. And that we didn't go into it a lot, but the miscarriage, the mental health aspect of it is so neglected that this is not just people that give birth. This is for women's mental health. So I'm excited about that. And then the little or smaller thing that I'm excited about is I know everyone was doing this over COVID, but my son and I have been trying to get down this recipe for sourdough, and it's in the oven right now. So I'm really excited.
Heck yeah. I can't even tell you how many times I have girl the sourdough on here. So frequently. Well, we are here for your sourdough.
Yeah.
We're proud.
It's exciting.
Okay, we're going to need a pic of the loaf.
Sour and proud.
Okay. Okay, good.
No matter.
So we're like the only ones that have not done that yet. Everyone in COVID
I haven't either. No.
Okay. All right. Well, yes. I'll send you guys a picture of how it turns out.
One loaf too far.
We want to see it. Okay, Caitlin, do you got one, or you want me to do it?
Sure, I'll go on the homesteading life train, though I'm so far from it. So, like a year ago, I started making homemade Greek yogurt, and recently got like this cool strainer, so it makes my life so much easier. Where I start my Instant Pot. I boil the milk, I let it come down to temp, I put in my 2 tablespoons of active yogurt with active cultures in it, turn it on, make yogurt for 9 or 10 hours. And then I take it and I just pour it into this thing. And there's a really fine mesh strainer at the top. And then the bottom catches all the liquid whey. And I'll put it in my fridge overnight, sometimes 16 or 18 hours to get it to the texture I want. But this is unlike sourdough. It's pretty hard to mess up. And it tastes so much better.
Really impressed.
It tastes so much better than like store-bought yogurt, and you save so much money. And my kids love it. And then we pick during the week, like, what topping do we want? So we'll like cook down frozen blueberries and add chia seeds, or this week we did raspberries. And it's really fun. It's not that hard. But one thing to know about the whey that comes off it, this took me a while to figure out. A lot of people like to save whey when they make cheese. I've never made cheese. It's different. This is like acid whey, and it's not high in protein. All the protein's in the yogurt. Okay, there's like so little protein.
I was wondering that.
In the whey that gets pulled off it. So I typically just dump it.
It's more like moisture than it is really anything, like acid, lactic acid and moisture.
Exactly.
That's impressive.
It's delicious.
Impressed.
You're making your own.
It's easier than you think.
Your own yogurt.
Allison's making her own bread. Caitlin's making her own yogurt. I'm making a mess in my kitchen. What am I making? Oh my gosh, my girl. Okay, well, it's like not that exciting, but do you guys remember how we had Whiskey Nomad Sarah on to talk about some mocktails and stuff? I'm gonna have lunch with her now. I'm getting off this call and I'm gonna go meet her for lunch. Yeah.
Oh, so fun.
Yummy.
So, pretty pumped.
Are you gonna have a little whiskey with her because she'll know what to order?
You know what? I'm not
too early in the
whiskey
day
at lunch.
Come on, you can do it.
There's more to her, okay? She's a human. She's not. Anyway, if you haven't listened to that episode and you're wondering about like herbal mocktails and what to do if you're now trying to conceive and you don't want your life to be all about alcohol anymore, but you're in that sort of industry, she has a lot of good stuff about that. But anyway, so moving on. That's my girl. I get to go see a friend for lunch.
Yay. That is a girl.
Thanks. That is a girl. I know. I'm making time for it. So, listener, we want to just first of all want to thank Allison for coming on and sharing her expertise and her heart towards mothers in every stage of their mothering. And we just want to encourage you to like and subscribe and to rate and review. And if you are watching this on YouTube, give us a comment. Tell us what you think. And we will see you next time.
Thank you so much. It was wonderful to be here.
We're so happy to have you.
Allison, you're just the way you even speak is like healing. I can't wait for people to get this episode.
Hey, it's Sophia. If you love the show and want to continue your health and fertility journey using our resources, head on over to foodfreedomfertility.com for show notes, links to products and services, information about our guests, and our newsletter. Again, that's foodfreedomfertility.com. Thanks for listening.